Welcome back to Squawk on the Street, live today from CNBC's Evolve Conference. It's a look at corporate leadership and transforming businesses in Lower Manhattan. I am here with one of the featured speakers, Mark Bertolini. He is the former CEO of Aetna, currently on the board of CVS Health. It's good to talk to you.
Good to see you.
Yeah, he got a very warm reception from the audience here, even gave out his email address. Mark, we need an update on the CVS Aetna deal and the status of the new company, because since that deal closed last November, the stock has lost about a third of its value. What do you think has investors so concerned?
Well, I think getting better understanding of what it is the two companies together are trying to put together. And there was just recently an investor conference that I think answered a lot of those questions, like what do we intend to do and what do we think about earnings over time. And I think Larry Merlo and the team put that out there. So I think that's a baseline. Now I think the next big step is executing against that.
How do you envision the combined company? When you made the deal with Larry Merlo, is it starting to look like what you had envisioned?
No, I think we're a ways away from that, and this is a complex integration, but the idea we had is how can we get closer to community? How can we create for individuals in the community easier access in their homes and in the community to care that is more effective, cheaper, and has higher value from a quality of life standpoint. And so that requires, the term I like to use is placemaking. How can we create in the community a place where people can gather to get what they need in the way of their health? Because what we're seeing now is 60% of the American public $400 away from a financial disaster, and the next 20, 4,000, that healthcare is now pushing people to the limit. And if we can do it better, cheaper, and more conveniently in the community, then that's going to be of value to those consumers. And so how do we use both the CVS assets and the Aetna assets in the community to bring more to the home and more away from the medical industrial complex, where the pricing arbitrage is so powerful, and just doing infusion in the home, getting DME purchased in a more convenient way. It'll cut costs. Yep.
I mean, that part of the concern is regulatory scrutiny, putting under one roof the retail pharmacies, the pharmacy benefits managers, the insurance business. I mean, how do you explain what we're going into, both on a bipartisan basis, and whether politicians are going to be looking into it?
So the problem is not how we finance healthcare. The problem is how we deliver it. And unless we get that investment right, how we finance it. If we finance a bad investment, whether that be a car or a home or a business, then we're going to get a bad return. We're not going to get what we expect. So if we were to look at healthcare as an individual right, an issue that we need to deal with, then how do we build it for me, for you, versus building it for the average ideal person, the cover of Men's Fitness magazine?
Well, some of the Democratic hopefuls, Elizabeth Warren, Bernie Sanders, Kamala Harris, have talked about this idea of Medicare for all, and getting rid of the private insurance industry. Is that realistic?
I don't think it is, for a number of reasons. Number one, nobody's defined it. And so if we're going to have the government finance everything, the investment still hasn't been solved. We're not doing the right investment. But when you ask people about Medicare for all, they can't answer the question. And when you say, well, show me another country where they're doing Medicare for all, they'll point to the UK and Canada. But those systems are not government-paid health care. They're government-funded and government-run health care. And we have a system like that in the United States. It's called the VA, which right now is not doing so well. And so what does the model really look like is question number one. Question number two, how much will it cost? And if you just finance a bad investment, you're going to get a bad result. And so Vermont has backed away from it 2 months before they were going to implement their single-payer program. Colorado passed it but couldn't afford it. And California's looking at something like $53 billion to do it.
Government doesn't have a good track record on this.
They don't have a good track record of doing it. So you need a public-private partnership, which is how Medicare runs. People say, well, Medicare is single-payer. No, it's not. Aetna has the first check that was written for Medicare back in 1965 from Aetna to Hartford Hospital. We were the financial intermediary. The government didn't pay it. We paid it. We set up all the systems. So if you create the right public-private partnership, how you finance it is irrelevant. It's what we do to invest in it.
Vice President Biden has talked about a solution where it's just restoring the Affordable Care Act Where are you on that? Because you did pull out of a lot of the exchanges in your time at Aetna. It just didn't seem to work.
The Affordable Care Act could have been solved a lot simpler than what we created. If we would have just reduced the age for Medicare and means tested that difference between the current age, let's say 55 and 65, and allowed people to buy in, and we had allowed Medicaid expansion to occur, we could have done exactly what the ACA has done, a lot cheaper. In two systems that already work from a financing standpoint and are structured and supported, by the way, by the industry in both, right? We are the financial intermediaries for both Medicare and Medicaid.
And this is obviously going to be a top-of-mind issue for voters going into 2020. What do you think is going to resonate most? Whose plan? What ideas?
Yeah, I think what people want to know is it's going to be better.
Cheaper.
And cheaper. And so if you look at, for example, the Amazon business model, what can I do to leverage my platform to meet an unmet customer need that is reliable, credible, and affordable? That's the same problem in healthcare. The unmet need is you're waiting until I'm broken to fix me. What can you do to help me live a healthy life?
This is what you did
in a convenient way. Right, it was what we did at Aetna. And so the idea is not to do a break-fix warranty operation, but to really do a program where the example I like to use is, and you're too young, triptychs from AAA, where you go on vacation and they give you the map and then they circle all the attractions along the way and they give you the guidebooks. Yeah, you bring the bag home and you look at it and you go, oh my God, we're going on vacation, where do we want to go? Well, if we were able to do that for healthcare and say, I want to live a healthier life, what are the things that work for me in the life I want to lead, and how does health get out of the way of the life I want to lead? Then you got people's attention and they'll engage.
Has the Trump administration done anything to move the system forward or backward?
No, I think it's stalled, and it's only worsening. The healthcare costs are breaking the back of our economy.
And so this is obviously going to be top of mind.
It should be. I think if you look at people who are looking at things like reverse mortgages, et cetera, they're all looking at it because they're just one deductible away from having a huge financial problem.
Finally, I just want to end where I began on CVS and how this is a company trying to transform this individually. There has been some uncertainty lately with these unprecedented hearings in Washington from a federal judge, Judge Leon, looking at the DOJ approval of this merger. Mm-hmm. Do you expect there to be any hiccups there?
After having been through the Humana transaction, I quite frankly
that got rejected.
Yeah, that got rejected. I don't take any bets on what's going to go happen with the DOJ and the judge. I think that's
legitimate
to be
concern.
Seen. I think it's something that people are confident can get through, but I think the judge has got to rule and do what he needs to do, and so I don't make any bets on that, and nor do I do any predictions.
Mark Bertolini, thank you very much.
Thank you.